All right, so let's talk a little bit about why you think you may even need to take a dietary supplement. You may be saying to yourself at this point, John, I don't really think I need to take dietary supplements. I eat a very good diet, I drink lots of water, I buy organic food. Why in the world would I even need to take a dietary supplement? That's a great question. But I can tell you today that almost everyone, I cannot think of one person who does not need to take a dietary supplement for one simple reason. No one eats a perfectly optimal diet. Even myself, I try to eat as well as I can every single day. Even when I'm traveling, I still try to eat a very, very good diet. But the reality is, we live in a very polluted world. We're subjected to all kinds of stress. We have all kinds of other insults to our body on a daily basis. And so if you're not taking a good quality dietary supplement, or I should say good quality dietary supplements, because it's impossible to get everything you need just in one tablet, capsule, liquid, whatever, you really are doing yourself a disservice. So I would encourage every one of you, even at your age today, you're younger, you're not thinking about disease at this point in your life, but this is the best time for you to get a grip on those behaviors. Start taking good quality dietary supplements today. We'll talk a little bit more about what goes into the process of selecting a good, let's say good, quote unquote, good supplement, but it's absolutely crucial. There are just too many things going on out in the environment that you cannot control that are constantly pressing down on you, causing you to be at greater risk of disease than people 100 years ago with all these chemicals and toxins floating around in the environment. And so it's very important for us to be as nutritionally optimal as we can. And unfortunately, folks, I'm sorry to say we cannot do that just with food alone. We really do need to supplement with dietary supplements for specific purposes. And certainly if you have any kind of a health challenge, that takes it to an even higher level of need. So just think about that for a moment. So now if I've helped you to understand the value and the real importance of taking dietary supplements to supplement your diet, why is it that some people take dietary supplements? Or in fact, let's go back to that earlier objective and say 40% of adults are taking something in this country. So 4 out of 10 people are taking something, and for what purpose are they doing it? So obviously there are lots of reasons. Well, number one, as I mentioned, you may need just an extra boost in some vitamins and minerals because your food simply cannot provide it. Even if you're eating 100% organic, a very clean, as we would think, clean diet where you're eating not much processed food, it's really food that comes directly from Mother Nature as it comes off the tree or out of the ground, even still you may need some extra vitamins and minerals. Well, that's one reason. What about if you're impaired? What if you have some sort of health challenge? I mean, that to me is even more important of a reason for you to be taking dietary supplements. So for example, in one of our studies, we showed that a polysaccharide formula, which we will talk about a little bit later, had a very significant impact on not only these two particular inflammatory markers here, and inflammation, by the way, is so critical to our daily lives today. You probably don't realize it, but you are constantly suffering from insults that cause you to have chronic systemic inflammation. So with dietary supplementation, we showed that we could actually bring those things down. Also, the adult stem cell marker here, this was very fascinating to us. We showed almost a 300% increase in our ability to proliferate adult stem cells with this particular polysaccharide formula. Now, for those of you who do not know, your adult stem cell making capacity is very high at a young age. At your age, it's probably as high as it's ever going to be, but as we age, unfortunately, that capacity goes down. So if you can take a dietary supplement to help boost that, particularly in middle or later age, then obviously that's very significant. So the impact of this is just simply that our adult stem cell making capacity allows us basically to be alive every single day. As we go through this daily programmed cell cycle of life and death, we want to be able to have our adult stem cells at a very high capacity, as high as they possibly can be. So what we showed in this study is that supplying the body with the raw materials it needs, turning on that stem cell making capacity, just did amazing things for the subjects in our study. So these are some of the reasons why you would want to take a dietary supplement. So for those of you who don't have a serious health challenge, something like cancer, heart disease, diabetes, Alzheimer's, you may say to yourself, okay, So now you're thinking that you want to prevent disease from happening in the first place. Well, what if you have that kind of disease? What if you already have something really serious, really life-threatening? Should you or can you take dietary supplements? I would argue to you again, absolutely. This is now even more important than ever. If your body is already suffering from something very critically debilitating, challenging your own existence, getting to the point where you may not even live, you absolutely want to give the body the raw materials it needs to repair, restore, and heal itself. There could be no greater reason than to do that. So I mentioned this polysaccharide formula that we worked with in the Alzheimer's study. I want to give you just an amazing case. It's going to blow you away when you look at this. So this gentleman had liver cancer, and this was metastatic, meaning that the liver cancer was starting from the liver and spreading to other parts of the body. Now, this poor man, in July of 1999, had given this terrible fate of, after surgery, radiation, and chemotherapy, "Sir, I'm sorry, we can do nothing else for you." He was sent to hospice. So this gentleman was sent to hospice after going through all the conventional treatment where he was given no hope at that point. Basically, going to hospice is your next step before the funeral home. And you can see here this image of how big this cancer was in his liver. Now, my colleague who worked with me also on the Alzheimer's study put him on the polysaccharide formula that we used in that study. And you can see in 1 year, this is going from July 1999 to July of 2000, look how much smaller that tumor got. Guess what, people? This gentleman ended up walking out of hospice. And, to our last knowledge, he's alive today. So, wow. What a wow moment. You want to talk about the power of nutrition, the power of dietary supplements, the ability to give the body what it needs to heal itself? There could be no better example than this graph right here, showing that this man went from being given up to die, basically no hope, to leaving hospice and still being alive today. So absolutely, if somebody has something as serious as cancer, heart disease, diabetes, whatever the case may be, don't let that person die. Don't succumb to it when there are options through nutrition, through the power of allowing the body to heal itself. Now, after we've talked about this example of this gentleman who actually allowed his body to heal itself through the power of nutrition, through the power of specific nutrients that we know work, you might think there's an irony there when you think about the FDA's definition of a dietary supplement versus a drug, where a drug is something that can be used legally to treat, cure, manage, mitigate, or prevent disease, but yet you cannot use that same language when it comes to dietary supplements and nutrition. That's a real irony, much in the sense that when you talk about something like scurvy, even though scurvy is very rare today, it's very uncommon today, but a few hundred years ago, before vitamin C was discovered, vitamin C from lemons, limes, and oranges was used to treat people with scurvy. And of course, sailors, people that were coming from Europe and the old country who were coming across to the Americas, they were dying in large numbers rapidly due to scurvy, among other things. And so one of the British colonels of their Navy discovered that giving those sailors the vitamin C through, again, lemons, limes, and oranges could prevent scurvy from even happening. And if somebody had scurvy, they could actually reverse it. But would anybody in their right mind today call a lemon, a lime, or an orange a drug? No. But yet, if you really think about it technically, it could almost be classified as a drug according to the FDA's definition. So there's a real irony there. And in fact, I find it's a real problem because it's getting into a gray area which could be very confusing to the average consumer. And meanwhile, you have to be so careful as a dietary supplement company in terms of the language that you can use, the wording that you can use, how you actually market your products, because of this irony that exists within what the FDA calls a drug and a dietary supplement, and then what we know through discoveries in science like this and other things where it almost doesn't even make sense. But keep that in mind. It's definitely food for thought, and it's certainly interesting as we move forward in this increasingly difficult time of what we call healthcare and treating ourselves. And that's why it's so important to take care of yourself and actually care for your health through the power of nutrition and supplementing with good, high-quality dietary supplements.